Thank you for joining this pre-recorded session of the Utah Outdoor Recreation Summit. We are excited to be talking about ParkRx. We'll tell you what it's about, how you can get involved locally, or how to build a coalition in your own community. My name is Sarah Kinnison, and I work for the Salt Lake County Health Department, and I'll be moderating this session. And I like to start this panel by asking the panelists to introduce themselves. So we'll go from John, Dart, and then LeeAnn.
Hello, everyone. This is John Henderson. I'm the Executive Director of ParkRx America.
Hi, I'm Dart Scmultz. I'm an Associate Professor at the University of Utah in the Department of Parks, Recreation, and Tourism, and I'm heading up a number of projects with graduate students and establishing a ParkRx program with the University of Utah Health System.
And I'm LeeAnn Powell. I am the Executive Director of the Utah Recreation and Parks Association. So we represent about 1,400 parks and recreation professionals throughout the state of Utah. And we feel as in parks and recreation that that we have maybe some of the solutions to help with society's bigger issues like health and wellness. And so we're excited to work with a lot of different partners and see what we can do to maybe put together a ParkRx program in Utah. So excited to be here and represent our parks and recreation folks.
All right, thank you all so much. We're excited to hear from all the experts. So to start off, John, would you give us some background on ParkRx America and what's happening nationally?
Yes. So ParkRx America is a national nonprofit. We are the only national nonprofit devoted to the promotion of the field of park prescription. We became a 501c3 nonprofit in 2017, and we built off of the work of Dr. Robert Zarr, who was a pediatrician here in Washington, D.C. He developed a model for park prescription, which I will describe. If you're not familiar with it, the whole concept is getting healthcare providers to write prescriptions to visit parks and other natural areas for the therapeutic health benefit, both physical and mental. It's intended to really benefit anyone and everyone, regardless of age and ability. The focus, however, from a medical standpoint, is to address a variety of chronic diseases, people at risk or suffering from things such as anxiety, depression, obesity, hypertension, and diabetes. So the photo was Dr. Zarr, our founder and medical director. His model really focuses on writing a prescription, a medical prescription, to visit parks and natural areas within the patient visit. And as we know, the patient visit is very small window of time, usually as few as 15 minutes. But he thought it was really important to do that because the whole concept is to leverage the trust relationship between the patient and the healthcare provider. And so by doing it in that setting and having that conversation with the patient right there and getting them to agree to fill the prescription that is going, making that visit to the park is really important. We focus on what we call near nature. So this nature pyramid, the bottom of it is where we're focused. The things that you can do on an everyday basis, which in most people, especially those living in cities, is the local park. So the whole idea is to build a habit of going outdoors and visiting your local park or other natural area, and develop that habit so that when you don't have the opportunity, you will really notice it. So it's building that habit and using local near-to-home resources. Our platform has the ability to deliver the prescription once it's written by the healthcare provider electronically via text message, and then the patient sends a text message back when the visit has been completed. We don't collect any personal information about the patient. All of that is kept confidential between the doctor and the patient. We do collect a lot of information about who's prescribing, how many prescriptions they are writing, the percentage of those that are filled, and where the patients are going, those park locations. So there are some challenges involved in doing this, and I think the two fundamental ones, this really started the whole concept with the National Park Service back in 2011, convening the steering committee to promote the concept of park prescription. It's been slower to catch on the medical side, and I think two fundamental reasons are that the park and public lands people speak a totally different language than doctors and people working in public health. So you have a communication barrier, and also most healthcare providers do not receive any education in medical school about the human health benefits of being outdoors. They are just like everyone else. They get bombarded with the messages about the dangers of being outdoors, such as sun exposure and insect-borne diseases. So that really creates a barrier to creating a durable and sustainable park prescription program. So I'll leave it there, and you can ask me questions. Thanks.
All right, thank you. I think we're just going to keep going, and then with presentations, and then we'll ask questions at the end. So Dart, let's get a perspective more local to Utah. So please tell us about some of your work at the University of Utah with ParkerX.
All right, I'm going to try to screen share here, see if I have any luck. Can you guys see that? Is
yes.
that working? Great. So we at the University of Utah we call ourselves the ParkRx team. More personally, we refer to it as the Wine Lab, Wellness in Nature Experiences, I think, among the group. But let's see, so I'm sort of the leader of the group. I am also working with Dr. Kelly Bricker, who's also the department head for PRT at the University of Utah, and we have 4 graduate students working with us: Mandy Shankmeyer, who's a PhD student; Sarah Tippler, PhD student; Scott Couch, who is a PhD student. He's just starting this fall, so we're excited to have him on board because he has a background in public health and is really excited to start working with some of the physicians up on the Hill, and hopefully starting to bridge some of that communication gap that, John, you mentioned in your words just a moment ago. And we also have Taylor Wyckoff, who's a master's student and doing some great work. So let's see. We've set up a protocol where a patient or a potential participant will be identified by a physician or a health coach within the U Health system, and then be referred through the EHR, through the electronic referral system called EPIC at U Health. And then that sort of pings or alerts my team that there's been somebody who's been referred to the UParkRx program. And then my team calls that or engages in a consultation process or with the referent, and identifies what the person likes to do, what parks or green spaces are nearby that person, so that we can make it accessible and easy and proximal to their residents, and maybe rope some of their family in, maybe their friends, get other people involved in this too, and get, as John said, into the habit of getting outside for that 15-20 minutes, and just making it more part of their daily experience. Building off of the, I don't want to get into too many details, but the ecological model, which suggests, you start with a microcosm and then you get into sort of outside of that, but building a culture within the community that makes this a habit or an acceptable practice that the entire community buys into and supports. And then the participant engages in the outdoor activity, and we, as our team, as the ParkRx team, provides continued support with the physicians and the participant and kind of monitors their engagement. And then ideally we will assess the program. We are working on identifying specific measures that we want to use to assess their subjective well-being. And then other measures that might be specific to the reason for which the physician prescribed ParkRx. So if they are looking to reduce stress, or if they've been prescribed for diabetes or pre-diabetic symptoms, then we will stay on top of those measures as well to try to collect some data to ensure or to build the base for the argument on behalf of ParkRx. I believe that a lot of the literature says that part of what the problem is with physician buy-in is the need for more data and support for ParkRx as a valid prescription tool for them to use more regularly in their practices. So some of the current ParkRx related projects we have going on at the U and our collaborators, one of our PhD students is building a program with students and looking at student well-being with the Center for Student Wellness. We're doing employee stress relief with nature adventures, walks, what have you, for well-being in collaboration with our Peak Fitness program, which is an employee fitness program, and Red Butte Gardens, which some of you may be familiar with. We're also looking very specifically at relationships between nature connectedness and body image and how that helps with overall well-being. This is with students through our Outdoor Adventures program. And I think she's also doing specific programs with first-generation students who find themselves on college campus without necessarily the support of their families knowing what they're going through. So this is a valuable service for them. We're also I'm currently working on a grant proposal looking at nature-based physical activity through the UParkRx program and the psychosocial health for cancer survivors, specifically gynecological cancer survivors, with the Huntsman Cancer Institute. And we also recently collected some data during the COVID-19 pandemic mitigation efforts and looking at how a nature-based activity helped with well-being. So those are some of the projects we have going on at the U. Yeah, to give you a feel for what we're working on specifically. Thanks.
Great. Yeah, thank you. So I like to jump in for a minute to just talk about some things that are happening in the state of Utah with the ParkRx Utah Coalition. And so the ParkRx Utah Coalition was created about a year ago, a little over a year ago. And we have a team of people in public health, in the healthcare industry, research, and parks, and everything you can think of. Because, you know, I started this idea, or not this, I didn't start this idea, but I heard about this idea about 2 or 3 years ago, and I realized we didn't really have a program here in the state of Utah where we are all, obviously, we have an outdoor rec office, and so we love the outdoors, but we didn't have a way to prescribe outdoor time to individuals. And as I was doing my research, I realized I just wear one hat, just being in the public health realm, and I really needed the support of the other sectors that were out there who also have the same passion about getting people outside, getting people moving, and getting people healthy. And so that's when we kind of pulled together a few stakeholders at the very beginning. So Dart and LeeAnn are on our coalition right now. And throughout the first year of the coalition, it was a lot of brainstorming and trying to figure out where do we start with. Do we start with creating programs, program planning, or do we need to get more feedback from other stakeholders? And so what we ended up doing in February, right before everything happened with the pandemic, we held a stakeholder retreat where we had about 60 individuals throughout the state of Utah attend so we can get their feedback. We had keynote speakers, but really the bulk of the meeting was about getting everybody's feedback and then also learning about who would like to be a part of this coalition. And so now we have probably, I would say 20 or 25 people on the coalition currently, and it's called ParkRx Utah. And we now have divided our efforts so we can really hit the ground running, starting to get programs out there, because the way that we see this ParkRx Utah name as being an umbrella. So having different programs fitting under this umbrella. So like Dart mentioned, there's a lot of things happening at the University of Utah, but we also, you know, if there's gonna be programs at individual parks or community programs, we really want to encompass that under this umbrella. And so now with our coalition, we actually have created working groups so we can get those programs running. And so right now we have a few work groups. We have a community work group, we have a data work group, we have a mental health work group, because especially in Utah, we have a major issue with mental health issues and suicide rates. And so we really want to focus especially on the mental health benefits of a park prescription program. So now we are dividing our efforts so we can get this program really solidified in the state of Utah. And so that's just an update on what the ParkRx Utah Coalition is. We also recommend everybody to go onto our social media pages. It's just called ParkRx Utah, and we really try to get that community engagement as well on those pages. So now, LeeAnn, so like you mentioned that you're the executive director of the Utah Recreation and Parks Association, and you work with local parks and rec officials across the entire state. So would you please mention an example where building this coalition has been successful, or perhaps how it might move forward?
Yes, I got to unmute myself. Yes, I am happy to share an example and just some thoughts on this. And as I mentioned, we're just really excited in the parks and recreation realm, you know, as kind of the pseudo owners of parks and open space land. Obviously, parks and recreation professionals would be very involved in any kind of a prescription parks program. But the other part of it is our parks and recreation folks are very involved in programming. That's kind of what we do, is we set up all of these great programs and get people involved. And so, you know, one of the things as we look at this, you know, we look at kind of a statewide coalition and trying to be that umbrella that you talked about, Sarah. And but the bottom line is, like, each individual community is going to set up different kinds of programs that meet their individual needs. So it's kind of a you know, really large scope that you're looking at to be that umbrella, but then give everybody the autonomy to run some programs under that umbrella. And I think that's where our park and recreation folks come in as kind of the boots on the ground in trying to establish those actual programs and have them be successful. As I've been doing some research, one of the areas that I've been quite intrigued with is the city of San Francisco. So they have a very strong Parks RX program. So they have a program where every Saturday at 10 o'clock in local parks, they have this program, and everybody in the community knows about it. The doctors, clinicians, caregivers, nutritionists, you know, it's not just doctors that would be writing these prescriptions. There's really a lot of healthcare people that would be involved in this. And they know that at 10 o'clock at this park on this Saturday, there's going to be this program. So they have an established program that people know about, that they can prescribe these prescriptions. And then it's actually, they have a leader that leads the program. So it's not just send somebody to the park, because I think one of the things we realize in providing these programs at parks is that you're taking a user group that is in high need for the health benefit to maybe use the parks, but probably have not used the parks in the past. So it's a group that's not experienced. So if you just send them to a park, they might not know what to do. They might not know how to make that a valuable experience. So if you can have a program that leads people through and can be all-inclusive and account for lots of different skills and ability levels and knowledge and those types of things, then it becomes very successful. So this program in San Francisco, it's basically a nature walk type of a program. So they invite people 10 o'clock on Saturday, here's the park, and then they go through some warm-up exercises and have conversations and make it a very warm, welcoming, inclusive type environment. And then they do this nature walk, and you know, they can talk about the values of parks, and they can talk about just different features of the park as they go through this nature walk, and then come back and have a cool down and really provide that emotional, social support system as part of this program. So, you know, I look to a program like that as very important. There's lots of pieces of that I think our Parks and Recreation people would really, really buy into. And interestingly enough, this program in San Francisco originated as part of a Bay Area coalition. So this coalition, much like what Sarah's putting together for Utah, brought all of these different Parks and Recreation folks together. So they did a program called First Saturday program. So the first Saturday of every month in every community had some kind of a program, so that it was consistent, so that the healthcare providers could know that just about any community that they looked at, there would be this program the first Saturday of every month. So, you know, I think as we continue on and look at what makes different programs successful, that continuity, getting everybody involved, having a leader there to make it a welcoming environment, and then building upon that are some things that are very important. So that's just an example. San Francisco and then that Bay Area coalition is something very similar to what I think we're trying to come up with here in Utah.
Thank you. Yeah, especially for sharing those specific examples. I think that helps get everybody's minds moving on how this could potentially look in their own community. And I think a lot of people who are going to be watching this, they may want to know, what are just a few small steps someone can take to get this going in their own community? So I would love to hear, this is open to anybody, to what are some ideas or steps that people can do to create a ParkRx program in their community?
Well, I think it's really important to have you know, the full court press. Yeah, everyone involved, as many people as possible. If it's viewed as only a top-down approach, you know, reaching out to healthcare providers and asking them to write the prescriptions, it's really not going to work. So all the things that Dart and LeeAnn discussed about getting, you know, the park and recreation community involved, or providing opportunities for people to come out, meet the doctors, and get the healthcare community excited about it and understand the benefits. It's really important. In our work, I'm trying to build a broader base for it. So if a community has a university, if there's a employer health and wellness program that can be convinced, you know, to do it. If there's a veterans program, public schools, you know, we have a pilot project here in the Washington, D.C. public schools, trying to get school personnel, you know, writing the prescriptions. So, and we also, in order to promote the kind of the bottom-up approach, we developed what we call the prescription card. So that you know, Park and Recreation Agency, they can hand it out at their facilities, at their programs, their events, and it has a URL code. And so the recipient of the card can log in and find out what ParkRx is about. They can take it to their healthcare provider and say, well, I would like one of these park prescriptions, and then the healthcare provider can log on and find out about it as
well. I would also throw out there, starting with something manageable, identify maybe a specific population, establish a specific protocol. How is this going to work? You know, what physician is going to be prescribing it, and work out what physician is going to be prescribing it, who's going to be in charge of then following up with the person who gets entered into the system. to make sure there's that hands-on, one-on-one sort of encouragement, accountability, helping that person identify what programs are available in the parks in their areas, working with your local parks and rec agencies to make sure there are programs available as part of the program. And you can start really small with maybe just something on Saturday or something, you know, that is a regular event that the participants can count on. But start with something small and manageable and work out some of the kinks. Make it doable, because if you try to tackle it all at once, I still wrestle with, and Sarah and LeeAnn have heard me say this before, I feel like I'm dealing with an octopus sometimes. And if you allow yourself to try to embrace the entire octopus, it's paralyzing. It can be really discouraging. So try to do something and that's very doable, and get the right people on board who can really be your support network to keep you motivated, to keep you going, because otherwise it's easy to just hit a wall and walk away from it, and that doesn't help anybody.
Yeah, I would echo some of the same thoughts that Dart has, because you look at, and especially trying, as Sarah is doing with our coalition, trying to do this on a statewide basis, you could kind of look at it and just get totally overwhelmed with everything it would take. And I think, just like Dart was just mentioning, if we can drill it down to individual communities, and so let's say there was a community out there that was interested in doing a Parks RX program. I think one of the steps would be finding some of those partners in the healthcare providers and like your county health department and the Parks and Recreation folks, and maybe there's other partners, Boys and Girls Club, or there, that you could kind of get your own committee together to really look at what it is you'd want to do. And then we can load up. I know one of the things we're working on with Parks and Recreation right now is trying to get all of the parks in the state loaded into the Parks RX America system, so that people are aware of where the parks are and what some of the amenities are in those parks. So that would be a good, important step. And then, like Dart was saying, come up with what could be just a program that you could put together, that you could offer for free, that you can make a very welcoming, something that people would want to be involved in, and start the program and start letting people know it's available, and then start to work out some of the kinks and questions and those types of things. And then if many communities are doing that type of thing, we can keep building and building and building. And so it can be overwhelming, like the octopus that Dart talks about, and lots of different things going in different directions. But I think the most important thing is to take some momentum. I feel like in the state, we're starting to gather some momentum, and to not lose sight of one program for one person is success, right? It's how do we take care of individuals? And if we run a program and we do it for 3 or 4 months and we've only got 4 or 5 people that are participating in that program, that is success. That is doing what we're trying to do. We're connecting people to nature. We're getting them outdoors. We're helping with physical and mental health and well-being, and that's what we're all about. So it's okay to just take it small steps at a time and keep the momentum going forward.
Another tip that I have is trying to identify a local champion. So in each jurisdiction, if you have someone who communicates, a healthcare professional who communicates well, both with Parks and Rec and the medical community, who is really charismatic and can be the media spokesperson and try and develop some excitement around it, is really, really useful. The downside is if like here in Washington, D.C., things are very transient. So you have your spokesperson, you're drumming up all this excitement, and then the person leaves, and you're left holding the bag. But I think in general, if you have someone to be the spokesperson who can communicate well in all those sectors, it's really helpful.
Yeah, and I'm just going to add on to that, John. I think communication becomes so crucial, and I feel like the health world and the Parks and Recreation world speak 2 different languages. And it becomes so important to have those conversations, because we're all in it together. We're all trying to get to the same spot, but we do it in very different ways. So to really open up those lines of communications with those community leaders and champions and partners that you're trying to bring together is critically important.
And I throw out there that one of the big barriers really is that language issue. But fortunately, we and you as a community, if you're watching this video, you might be interested in or getting inspired to try something. You're not the first person, you're not the first group to forge this path. There are people out there who have done this kind of thing before and have built partnerships between communities, parks and rec organizators, state and county parks rec and city parks and rec organizations, and healthcare systems who might have different means, but they're all working toward the same end. So there are a lot of resources on websites out there. There are people in different states and in different communities and right here on this panel whom you can reach out to and talk to about how do I break that? How do I start the conversation? How do we identify, okay, this is the end we're all working toward, and how do we serve all the needs of these different partners who are coming in together on this effort? So there are resources for you to turn to, and it's amazing. The more I work with this coalition, and it's easy, especially during quarantine, for me to sit there and think, oh, I'm all alone in this effort, and I have to do this, and I have to build this, and I have to take care of that. But even just doing this, I'm reminded of what LeeAnn is doing with the parks and what's happening statewide with them loading their parks. If the different recreation agencies are loading their park information on the websites that John has put together, I don't have to do that. That's not my responsibility. I have a partner in this who is taking care of that, and I can be doing something else. And it's amazing how many different arms are actually being managed by other groups. So don't be afraid to reach out, and don't be afraid to stay in touch with us or with, use the websites that John is working on and that John has put together in those tools. There are people out there who've wrestled with these same things. So I'm battling now.
I'll do a quick plug for ParkRx America. We have a lot of resources on our website, and I think it's pretty user-friendly. The basic platform is entirely free. So if you are interested in creating a ParkRx program, or if you just want to amplify what you're already doing, it's a free tool. So it's free for everyone. So please use it.
Yeah, I actually was just about to plug that for you, so I'm glad that you brought that up. We actually use the ParkRx America database. We only have them on the parks from Salt Lake County, but it's easy for anybody to use, even for the medical professionals that may prescribe parks from this database. It's very simple, and I do recommend everybody to visit parkrxamerica.org just to look at all the resources. And also there's tutorials on how to prescribe the parks. Like, I think the video is 1 minute long, so it's definitely something that you could introduce to medical professionals as you're making that conversation. But we talked about that there are barriers when park and rec agencies or professionals may speak to medical professionals. And I don't know, John, if you have any insight on, examples, even if they're examples of kind of the barriers that you've been facing. What can people, I guess, expect when they're reaching out to these medical professionals to kind of get on board with this idea?
Well, let me say that when I've seen Dr. Czar, our founder, do what they call ground rounds presentations at hospitals and talking to doctors, we get the question, that Dart mentioned about what is the evidence that this really works? Why should we be taking valuable time out of our visit, to write one of these park prescriptions? And then they also ask the questions, well, are these parks safe? What are the liabilities if someone gets injured? So sometimes there can be just some lot of barriers right there trying to communicate with a healthcare professional. Even Dr. Czar, who is totally committed, passionate, charismatic. Sometimes he has difficulty, communicating with them. So, as I mentioned before, if you can identify someone who communicates well in all of the sectors, and kind of build from there, sometimes I describe it as a bell curve. You have the early adopters, the people who are really outdoors persons to start with, who are the healthcare providers, and they are really excited about it. They love the concept, and they do it. So if you can find a group of healthcare providers, just to start simply, and don't be discouraged, because it does take a while to build up a critical mass when you're developing the program. So there are no silver bullets, let me put it that way.
Okay, thank you. All right, so I want to switch gears just a little bit. Hopefully that gave you a lot of good information about how you can start a program, where you can start, and just reminding yourself that you don't have to start big, start small. But as we have talked about, there's a lot of research about time spent in nature, particularly for kids as well. I don't think we've touched base on that a lot, but it's out there. But I do want to ask the group how they think parks and city green spaces can help address issues of health equity, for instance, physical, emotional, mental, social health equity issues.
I'll jump in. The value of green space and parks, first of all, is that, it's relatively accessible. Most communities have some green space. I suppose there's some question as to whether or not there's equal distribution and there's disparity in terms of access. But it's also free, where a lot of other physical activity engagement opportunities require some sort of have a cost associated with it. So the ParkRx, one of the advantages of ParkRx is that it's cost efficient, which helps with populations that are of a low income. I would also throw out there that if you're a community that's looking to try to increase access to parks for Black, Indigenous, and people of color in your communities, that one of the very first things you should do, and I think this is important, even, just getting your ParkRx program going, is why are you doing it? One of the great national conversations we're having right now is how widespread whiteness is in our culture. And I think we're all at risk to some degree of wanting to do or consider something like an increasing health equity for health and wellness and a ParkRx program. Ultimately, the goal is, if we don't really address the why, what ends up happening is it's just a bunch of white people patting them on the back saying, look at us, we increased color, people of color in using our parks. That's to the advantage of white people, and it's just making white people feel better. But if you're going to provide a service that really serves the culture of the people you're trying to reach, that's what we're trying to do. I might not be explaining it well. I'm glad to see John nodding that maybe I've gotten some message across, but I felt it important to throw that out there, especially given the national conversation, that we need to be very clear about our why, and that it's not just because white people want to feel good about an effort they're making.
Let me say that an advantage of ParkRx is that the prescriptions are individualized to the patient need. So Dr. Czar works in a clinic here in Washington. It's a very low income, a lot of Hispanics. Dr. Czar is bilingual. So that is extremely helpful. I'm also a park planner, and so I'm very sensitive to the issues of distribution of park experiences. There's a whole spectrum of experience that a park can provide. So there's a big campaign, you should be within 10-minute walk to a park. But if that park doesn't meet the need that you have that experience, it may not, it's useless. So in the African American community, there's a lot of cultural barriers to using parks in the community. It's historical and cultural. You could have someone living next door to a park and they are afraid to use that park. They will never go into that park. And so providing, that's one of the great things about a program like ParkRx. It does provide that incentive and that nudge, and you take baby steps to get people used to the idea of being outdoors, and then maybe it's a social experience that allow people to go into that park and really understand the richness and the resources and the availability and kind of build from there. So there are a lot more challenges to it. It's much more complex than I think most people would think.
And I would also just add to that, I think, kind of back to that, the importance of communication and the importance of coalition building, that even within your communities, as you start to look at these programs, and quite frankly, all of your programs, it becomes very important to bring lots of different groups and people to the table to have the conversations. Because I think a lot of times we don't even know what we don't know when it comes to culture and why maybe one group will use a park and one will not use a park, and some of those disparities. And so I think it's so important to get people into a safe space and have those conversations so that we start creating programs that make sense for everyone and can be inclusive of everyone. So, again, it's a lot of, again, the boots on the ground and taking the time to really understand your community, get some people together, get partners and coalition together, talk about what it is that the community needs. And, I think that's a very important kind of first step, is you start to create programs and build programs towards this ParksRx.
Okay, thank you, everybody. Everybody had really good insights about that. So thank you so much for that. We are running out of time. So I just want to see if anyone had any last remarks that they wanted to say, or anything just to wrap this up.
I'll throw out there that if you are going to get a program started, please stay in touch with us, because we would love to let you know what measures we are using to assess or evaluate programs across the state, so we can get some consistent data. And really, we'd also like to just keep our proverbial finger on the pulse of ParkRx programs so that we can build a unified coalition and get that, as Sarah mentioned, sort of an informed umbrella service going, so that we all know what is going on across the state and really get it statewide.
Yeah, and you can reach out. You can visit parkrxutah.org. That's where we get all the information. I think there's a tab even that says get into contact with us. So if you want to be a part of the coalition or just let us know what you're doing, that's the easiest way to get a hold of us.
I'd just like to say that local park and recreation agencies are an underappreciated resource in a lot of jurisdictions. They're usually the first thing to get cut when there's a recession. They provide invaluable service, and now because of the pandemic, I think people have the opportunity to go outdoors to visit their parks, and hopefully that's increasing the level of support overall for parks and recreation.
Thanks for that, John. I will echo that same thing. I think through this COVID-19 pandemic, people have really started to appreciate their parks and open spaces and have been using them at record pace. But I just want to say I am extremely excited for the steps that Sarah and the coalition have taken already, and it's great to see the programs at the University of Utah with DART and Dr. Bricker that are already kind of up and going and getting going, and that gives us inspiration to know that we're going to be able to do this, and we're excited to get as many people involved. And you look at generational change and the potential we have to truly make a difference in Utah and to increase the health and wellness for generations to come. And so though it feels like the octopus going, it's so exciting to think about the potential and where we can go. And so we're excited to get as many people as we can involved, as many communities involved. And we do want to be that kind of umbrella group that has maybe researched some of the best practices and has some ideas, and we'll share it with you. And we just want to get as many communities involved as we can. So just excited about this and the work that everybody's doing, and can't wait to keep going with it.
Okay, great. Well, I want to just thank you all for joining us today and sharing your thoughts and experiences with us to hopefully help give people ideas on how they can create their own ParkourX program and how they can get involved. And so again, we recommend that you just go to ParkourX America or ParkourX Utah to learn more. So thank you.